Good afternoon, everyone. I want to welcome you to another SMI to You webinar. Today, we are joining our Trading Partner Collaboration Initiative team, our team leaders, to report out on all of the great work they did on researching the benefits of collaboration and understanding what great collaboration relationships really look like. We're delighted to have all of you here participating today. We do have our participants in listen-only mode. If there's an opportunity for questions, we will ask you to use the questions feature to submit those questions, and we will read those to our panelists. And we are looking forward to your input. We are using some polling today, so we're looking forward to having everybody participate with the polling feature as well. Next slide, please. So we wanted to welcome our three panelists, John Strong, who's the Chief Consulting Officer of Access Strategy Partners. And John's been a long-time partner of SMI, helping us with a number of different initiatives, and has been really a great partner in helping Tom and Les lead this initiative. Likewise, we have Les Friend, the Executive Director of Enterprise Sales from Karl Storz, Endoscopy America. Les is an SMI member, and Les has been helping to lead this initiative with the team as we work to define best practices in trading partner collaboration. And then finally, we've got Tom Lubotsky, the Vice President of Supply Chain at Allina Health, another one of our member team leads. And we're really grateful to Tom and Les for all of your leadership in helping to bring all this material together. John's going to be kicking us off today, and then we'll be asking some questions of Tom and Les. They're each going to have some material to share with you today. And as I mentioned, we will have some polling questions to get input from the group. So we're really delighted to have all of you here today and look forward to a great presentation. John, I see you've gone off video. Are you able to come back on, or do you want to be just audio at this point? Did we lose John? Christine, I'm seeing that John is showing offline.
Yeah. Yep, and I just sent him a chat, so we'll see if he can come back on. He's trying to dial back in right now.
Okay, great. The wonders of modern technology. So thanks everyone for your patience. We'll give, since John's kicking off the presentation, we'll give John a couple of seconds to see if he can get back in and lead off the discussion and bring Tom and Les into the conversation. But Tom or Les, we may be asking you in a minute to kind of pinch hit for John until he can join back in and get his technology working.
Understood.
These virtual engagements are great, but sometimes when the technology doesn't work, we have to punt a little bit. So why don't we, Tom or Les, which one of you would like to sort of pinch hit for John while he's trying to get his technology working?
Well, I can certainly try.
Okay, wonderful.
Sorry,
We'll let you.
I lost connection for a moment there. I apologize.
There you're back.
John.
Excellent, John. So we've got you on audio, John. We don't have you on video, but that's okay. And we will let you kick off the presentation if you're ready to go.
All right, thanks, Nancy. It's a pleasure to be with you all this afternoon. Nancy introduced Les and Tom, and we thought we'd keep this rather informal this afternoon. We're going to talk about a few slides. We've got a couple of discussion questions between us. And as Nancy mentioned, we've also got a couple of polling questions, so we'll be doing those with you this afternoon. So we expect this to last approximately 60 minutes, and if you have questions at the end, we've reserved time for that as well. So to open up, if you could go to the next slide, Christine. And the next one. Well, the next slide is coming up. I would point out that SMI has been at this for about 5 years now, and what you should be seeing on your screen is sort of a timetable of where SMI has been along the journey of trading partner collaboration. And if you go back to 2010, you'll see that there was a trading partner evaluation tool that was actually at the time was very innovative, and I think it's still out on the SMI website. It allows you to do evaluations of trading partner relationships, and it also provides some quantitative information about those types of relationships. Back in 2014 and 2015, SMI decided that they wanted to start exploring alliances. And as we got into the research behind it, we decided that that might be too heady a goal. There really are no trading partner alliance type relationships within healthcare. And so the initiative sort of moved to the area of collaboration. And we began by taking a 360-degree view of trading partners and trading partner relationships. And that actually led to 5 different pilot projects that we did around 2015 and into 2016. And some of that information is also available out on the SMI website to this day. From that, we began talking about, well, what would it take? SMI's got perfect relationship information in areas such as the perfect invoice, the perfect purchase order, and things like that. What if we could develop some more materials around the idea of the perfect relationship? And so we began going down that road, did a great deal of research. And as you'll hear from Tom in just a few minutes, we began in 2018 and 2019 bringing outside speakers in from places like McDonald's and Johnson & Johnson and others. And they they discussed a whole wide range view of collaboration and how they actually worked with their trading partners, all the way from contracting through Johnson & Johnson with certain handshake agreements. So we find ourselves today here at sort of the wrap-up session. And Christine, if you'll go to the next slide. Going back to the very beginning of this, we found this information from AMR research. I think it's 7 or 8 years old now. And you'll be seeing through the course of today's discussion, we're going to talk a little bit about how COVID-19 has really impacted trading partner relationships. It's sort of something new that we're taking a look at now. But historically, healthcare and the life sciences have had sort of the least amount of trading partner collaboration over the years. And I think you've all probably seen this slide before. So one of the things we want to unpack this afternoon is there a historic opportunity really to change trading partner relationships in this sector, given the fact of what we've learned from the pandemic so far. Next slide, please. Again, going back a little ways, this is information from Vantage Partners. It's a little bit dated now, but it proves the point on why trading partner relationships in all sectors are really difficult. You'll see on the left-hand side the type of value that suppliers can provide, and it's arrayed in the next column with the importance to customers, going from 1 through 6. And if you take a look at the right-hand side, I apologize, there's a 7 in there, that should be a 6. The importance to suppliers doesn't necessarily always meet or even come close to the importance to customers. And so over the years, we've sort of concluded that this mismatch is one of the things that makes all of this collaborative work so challenging. Next slide. And again, we want to talk a little bit today in some of our discussion questions about the whole pandemic and how it is or may be changing trading partner relationships. It's certainly not any mystery to most people on this call, I'm sure, that most of these relationships have been highly transactional over the years. And there's a multitude of reasons. We've unpacked all sorts of reasons why, but we really chose to focus on how we could sort of change that paradigm and move into the collaborative and then into more of the alliance and perfect relationships that are out there. Next slide. So just a slide that we pulled out that I continue to get laughs at every once in a while. If you talk to most suppliers along the healthcare supply chain today, they believe pre-COVID that there was a huge emphasis on price. And we've just got a little scenario here with the 2 guys you may recognize saying that we don't give a damn about your so-called value-added features, we want a better price. And I think people are learning through COVID-19 that while a low price may be very alluring, if you can't get product at that price, it really doesn't matter whether you got that price in the very beginning or not. And so we hope to kind of unpack this a little bit more today. Next slide. So my final slide here before I turn this over to some discussion and to Tom is really around this whole notion of key questions that we've developed over the course of the last 5 years or so. And I think the first question on there, which was developed probably more than a year ago, is the current environment conducive to more and better trading partner collaboration? I think we're seeing that perhaps it is. And so one of the things that we want to unpack with Les and Tom today is whether that's really true or not. So with that, I want to turn to the first discussion question that we put together, and I'd ask Tom and Les to chime in on this. It goes like this: because of the move to more virtual meetings such as Zoom or this type of meeting, do you believe that the discussion of better trading partner relationships has fundamentally changed since COVID-19? Tom, what do you think about that? You're on the front lines every day.
Well, I think despite all the sudden disruptions and the challenges to probably managing our cash flow, most of our supply chain executives are emphasizing the value of the supply chain and during this downturn. So the last 3-4 months have certainly been challenging, but I think we all see an opportunity to review the objectives and activities to deliver, value beyond savings, such as the risk mitigation, the continuity of operations, or even innovation for growth. And clearly, we know that some of our internal partners, we've been focusing hard on accelerating those collaborative efforts to ways to improve our communication, share the key performance indicators, and our supply chain agility, right, to enable more trust. So, I think that there's probably, still this, what I call the glue between ourselves and suppliers around driving more value. And as we've gone through this experience, hopefully we understand that there's this evolution around the relationships with ourselves that hopefully define or resegment the supply base, improve our communication, accelerate the supplier support we need, offer even more support to the more vulnerable suppliers as well, and partner with them to innovate for growth. So I think that this is, if anything, this has accentuated more the importance around evolving our supplier and partner relationships going forward.
Great. Les, you and I were talking a little earlier today and laughing about the number of Zoom meetings that we've both been doing. You think things have fundamentally changed since the pandemic started?
Well, from a better trading partner relationships, I can't say that we're there yet, but has it changed it? To piggyback on what Tom was talking about, absolutely. We've had some very insightful discussions with a lot of our clients and potential clients around how can we as a supplier bring value in a different way, just exactly what Tom was mentioning. And so I hope that this is going to be the catalyst that will push many organizations to fundamentally want to change the way they look at the supplier relationship. I agree with Tom. Supply chain in itself is certainly very visible now, not only in the United States, but just in a whole. I'm talking about everybody in the United States understands what the word supply chain means now, but definitely in the healthcare circles. We know that things will have to change, and it's coming. I think we're at the beginning of that. We're just at the starting of the change.
Okay, great, thank you. One of the things that I think people valued over the years was this whole notion of interpersonal contact, where sales representatives would come in and visit. Do you think those? This is a little unfair to Tom and Les because it's not on the script, but. Do you think it's fundamentally going to change and we're going to be doing a lot more Zoom type meetings over the next few years?
This is Les. I mean, this is going to be part of the new norm. I would agree on that. And we're certainly making every effort to make sure that we've got the right tools for our folks to do that. With us being in the surgical space, this is certainly an area that, healthcare providers are very protective of allowing suppliers into. However, for us to truly collaborate, can we improve quality? Can we improve operations in the OR virtually? And I think there's some tools out there that will allow that. And I think you're going to continue to see quite a bit of that. There's, the whole issue around telehealth, but there's also just telehelping. And I think you're going to see more of that.
Okay, great. Tom, any thoughts on that?
Yeah, I would just simply add that, look, I think as it relates to the kind of the corporate functions of conducting sourcing and that kind of efforts, doing that virtually. I'm not sure that there's going to be remarkably a different change there in conducting the business in that fashion versus doing it in person. I think the balance of doing things in person versus virtually should be managed. I think that's important. It shouldn't always be virtually. But if there are existing relationships, I think, what we've learned is, actually the access, the speed by getting people pulled together and doing a Zoom call or whatever is actually perhaps more nimble and more productive. So, I continue to see that. But to Les's point around in the operations where suppliers are providing a specific level of service for patients. So while they're teeing up the slides, I thought I'd reflect a little bit about the work that we were initiating from the very get-go. I mean, this goes back to September 2018, but we had asked the group about their initial thoughts on building out what did it mean around collaborative relationship, and a lot of questions were raised around what are meaningful metrics, what are the how to identify what are the expectations and the goals between the both. Supplier data is a challenge to obtain. How do we shake things up doing leading edge things that push the status quo around the relationships as they exist? Those were some initial thoughts as we got started. What was interesting to me was, some of the things that stood out around in a pre-survey that we did around value-based collaboration, things such as lack of transparency, my goals and objectives, strategies don't align. And I think that word alignment between provider and suppliers, I think it's really important in the relationship. There's certainly the element of trust. You can do all the right things, but do you really trust each other at the end of the day? And that generates good collaboration. There's a lack of shared risk in developing these relationships was also one of the remarks. And sometimes it takes a lot of time to do this, and I couldn't agree more with that. We did end up with a mission statement that I always thought was kind of long, but it was good. And I was saying, our mission was to, using examples from healthcare and other industries, we would look and examine how trading partners can attain a common culture of good collaborative relationships using new, innovative, and tangible ideas as a basis for that work. And that will develop our work on principles such as joint value creation, creating platforms for meaningful trading partner collaboration, implementation paths, and the development of better metrics for evaluating the success of these relationships. So, those were some of the things that kind of stood out at the very beginning as we examined these relationships. So as we got into it, if you go to the next frame there. Okay, there we go. As we talked about these relationships, I want to bring in place some of the things that were addressed. As you can see, the contrast in these two frames around least collaborative and most collaborative. We really began to form around what were the key things that were most important around things that had to be addressed. And so exploring what trading partner collaboration means, what's obviously most attractive, least attractive, what resources are required to execute more effectively on it. How do we use our business reviews to foster, better trading relationships, development of joint value creation, risk-sharing contracts, as I mentioned, understanding how trading partners in other industries attain a common culture. Outside healthcare, as you know, in more mature industries such as retail and automotive, as we discovered, we talked with people from J&J on the consumer side, as well as with McDonald's. They outsource a lot of their supply chain sourcing and operations to an organization called Javi. We learned about how they obviously mature the relationships. And some of it was a bit surprising, particularly the story around McDonald's, who I would have thought had advanced a matured fashion around the relationships, and discovered that they, within I would say the last 5 to 7 years, have begun to really mature a more pronounced way in terms of how they interact with their suppliers. So those were, some of the things that we discovered along the way. And then we had some early on lessons that we heard from people like George Hirsch and out at Norton Healthcare. And we learned about a specific example around their work related to, I think it was biomedical engineering, that they had some real success with outsourcing that capability and the partner that they used to address that. We also learned from the supplier viewpoint. We had Ruben Taborda from Johnson & Johnson talk about some of the work that they're doing and what, from their perspective, how they view collaboration, where they've dedicated a division that's devoted really towards advancing the materials and supply chain improvement in the operations around inventory management. And then we, had a good discussion around trading partner collaboration in other industries as well. So, we began to really understand the differences, the perspectives, the viewpoints, and began to really make some headway around all of that. But, again, as John had pointed out earlier, healthcare still underutilizes information sharing with suppliers compared to other industries. And when you look at auto, chemical, consumers, and so forth industries, that we're still woefully behind on advancing how we use that information together to develop and drive better value-based relationships. You can go to the next frame. So one of the things that caught my attention was, what are all the components of a perfect relationship? And one of the speakers we had that spent some time with us, and some of you may know her, is Kate Vitasic. And she was the Associate Dean at the University of Tennessee for the Center for Executive Education. And the coined term called the vested business model was a mindset, a methodology about how to develop collaborative relationships, how to develop more win-win objectives. What's this ecosystem around what it looks like in terms of advancing good, sound trading partner relationships that drive innovation was a big part of her focus. And so she's written, by the way, 6 books. I would encourage as part of the literature here. If you are not familiar with that, that was a key bit of intelligence that we gain along the path around all this learning. But as you see around these components, clear expectation and goals, this word around alignment of goals and strategy. How do you look at each of the supplier and providers and align their goals and objectives and find that true ground where collaboration begin to develop some real value for both sides? It can't be one-sided. It's got to drive value for both. And so I think that's really important. We obviously know about transparency and the lack of it in terms of developing a trustworthy relationship along the way that we understand is so important. Time, the investment of time to doing this, to developing these relationships, indeed take a resource and time. And anyone who thinks that they, can develop a model and begin to evolve something, somewhat loosely, is going to find that it doesn't work that way. Getting deeper, not just with the senior leadership, but getting deeper inside each of the organizations is really going to be important. And then metrics. How do we quantify that? How do we really measure that properly? How do we know it's reliable? It's got integrity. All these things are important elements around that drive a really sound, perfect relationship. If you go to the next frame. So just to build on that, part of the work that we did was also look at, what are those factors that really make us most successful. And we had some interesting presentations. One from Eric Mitleach from Lemire. He talked about 3 tenets around scope alignment between both the shared incentives, but between trading partners And then being a database organization as they are, really what's the source of truth? What are the agreed upon data elements, the sources where they come from, that there's an agreement on to measure, whether it's a process improvement, whether it's a result improvement that we're all after. That was an interesting discussion. And we had a provider viewpoint also shared from Bruce Mayrose from Mayo, and a supplier viewpoint from Keith LaFrance from J&J as well, around all these 10 critical factors, and they shared their insights around things that are most important. And then also we had a discussion from Armin Klein that talked about market segmentation as being a part of really making sure that you do that well, to understand exactly how to address the needs and wants of providers in this case, he was coming from the supplier viewpoint, but that he believed it leads to better trading partnerships and relationships, and that there must be a willingness, an effort, as I said, time, and to really make these work, but the risk and the transparency that go along with it are indeed are truly, truly important. And then you also talked about, using even getting, we're all familiar with the term RACI, looking at responsibility, the accountability, the consulting role or the informed role around both sides, and get much more deep in terms around what are the roles of each of the players between a trading partner relationship that makes sense, that need to be pursued. So all these things were really, really important. The other thing that I thought was striking was Caitlin Pappas from J&J. She ran a consumer division before she moved into the medical device role, and her alignment, her story about sharing with Walmart, where Walmart years ago, and we're talking many years ago, but they did the same thing that many of us as providers are doing today in terms of managing their inventory, and decided one day that why are we working so hard and spending all this money and resources and so forth, where we can ask our suppliers to manage the shelves. And so they actually went to J&J and said, if it's for the category, let's say of diapers, you guys manage the shelves. You do all the inventory management. You select also who are going to be on those shelves. We're going to turn that over to you. We're not going to pay you. It allows you to really begin to manage the turns around your own product, as well as help your other competitors in a sense, but it gives you the in around managing that inventory. And if they were the dominant supplier, then that aided them, of course, very, very well. Now, the firewalls that got established between J&J and other competitors in doing that work, I don't quite all understand, but that's how it was carried out. So these principles are thinking, outside the box, looking at dismantling the traditional ways of thinking around our relationships are some of the things that I thought Caitlin brought an interesting perspective, saying, how do you apply that to healthcare, or could that possibly be done? And could you go to the next frame? Then, we talk about the stages of these relationships and how do you grow them? And this, as we know, takes time. And I had espoused about a relationship model that talks about obviously transactional, one that turns collaborative, one that maybe becomes a series of projects that's much more strategic, and then really integrated relationships. But they all evolve in some sort of maturity scale, as we all know. We heard, as I mentioned, around the Javi relationship with McDonald's and how they evolved that work with all of them, and that would turn out to be some interesting work around that they hadn't done over the last year, but they began to look at their top 75 suppliers and determined that, look, 5 of them really fall in this stage of strategic or more advanced relationships. A core of them really represent 20 to 25 of them around the core, and then foundational, which really, I think, meant more transactional. 45 to 50 of them were more transactional. But the point here is that there's a scale of engagement, and there's a scale of development and developing these perfect relationships that we learned along the way in this venture around the work we did. And then lastly, we had people like Donna Valera from Parkview in Indiana that talked about their framework, their model of sustaining relationships with their suppliers in a very formal way of setting criteria for identifying what they call strategic vendors. They had goals for both sides. They had rewards and incentives, and they had, of course, a vendor scoring tool as well. So these are some examples along the way. If you go to the last frame here, there are kind of 4 key pieces that I think when one walks away around what do these relationships really mean in terms of advancing going forward. The alignment of the incentives are clear. That means spending time up front, really defining between both what are the clear goals and expectations of both, and what are the things that need to be perhaps then figured out around, well, how do we develop incentives so that there's a win-win relationship, going back to Kate Fatasic and the things and principles around the vested model. Secondly, measure value beyond the cost savings. I think we all know that, but what is that value? And we so often focus on price, but we can't feed this in for the short term. If you're going to evolve these relationships, I think one of the key learnings is you got to develop it for the long term. And that means really addressing other things outside price that are going to bring longer term value and committing time, resources, energy, and investment to that. And then shortly we'll hear from Les here about sharing risk. What are those models out there around that need to be addressed around sharing risk together that could be done around certain product categories. I know of some stories out there that clearly exist out there that people have begun to venture into these models, and we should learn more and more from them as they become more visible. And then lastly, the sustained collaboration. Ed Harden from Freighter talked about his, specific model around strategic partnership models that he has developed with his suppliers. And it's a very, very formal way to engage the suppliers to help them help Freighter to develop better, stronger supplier relationship management, help them to meet the specific goals of Freighter around what he's after, and getting them engaged in that work. So these are just some of the things that we talked about along this path. This is a quick summary, but I tried to grab some of the path here over the last couple of years around what did we learn from all these trading partner relationships and how to build them more strongly. So I think we go to the next question here, and this is really for Les and John, and that is, what do you believe are some of the fundamental underlying issues that you believe make trading partner collaboration in healthcare more difficult than in other industries? So, John, I'll start with you. What are your thoughts that make this more difficult than other industries?
Thanks, Tom. I don't know if this is more difficult, but I think one of the really underlying things that I've observed, and you actually just touched on it with the desire for long-term relationships, is that the development of these types of collaborative relationships really take time and they take a lot of effort. And you touched on some of the things we've identified over the last few years. I think whether you're a trading partner on the buy side or the sell side, everybody's time today is just so tight. And then we had the pandemic and a whole host of other issues. And I think that one of the key learnings was that it really takes a good deal of time to build not only trusting relationships, but to foster institutional trust.
Thank you.
Where there's good trust on both sides, and it's not just at one level in the organization, it's up and down both the buyer and the seller in the trading partner organizations. And so I would probably say that I think that as we did the pilot studies and as we learn more and more, having people spend the right amount of time on this was a challenge for everybody, no matter what side of the desk you sat on.
I would agree. I agree.
Great point. Great points. Yeah, I think, John, you really did a good job kind of covering it there, but the underlying issues, Tom did a great job on a couple of those slides really showing, and they're still there. The reason it's also the one thing we didn't say is there's always been this challenge between the healthcare provider and the supplier of I don't want the fox in the hen house. You know, there's still that, and I don't want to use the word trust because I don't think that's probably accurate, but it's, you know, getting a supplier more ingrained in my organization doesn't always make people feel more comfortable. And I think we can overcome that. That can happen over time because we do need to collaborate. We've seen this full bore here. So I think, you know, we're, again, as I mentioned earlier in our discussion today, I think we're at the beginning of how we're going to start seeing this get more like some of the other industries. I think, you know, one of the things that was most fascinating when we talked to the folks at Nissan Motors about how they handle suppliers. I mean, they embed the supplier actually in their factory. They said, why would you rent space? I'll give you space. I want you to be right here to help me solve problems. You know, how often has that happened in healthcare? I'm sure there's been some cases where, you know, suppliers have said, get in here and we want, I mean, healthcare providers have said, suppliers, we want you in here and we want you in here all the time. But we're not there yet because it is a lot of work. And I feel for Tom, for example, and other healthcare providers on the phone, you guys have just a boatload of suppliers that you work with. So it can only be that strategic few that are really impactful to your business. So we're going to get there. It's everyone's, I think, intention, but we sure learned a lot. And I did personally about how hard it is to get over that next hurdle.
Hey, by the way, I just got to piggyback on that last comment with Nissan because this is true for Toyota. But as integrated as those relationships are with their suppliers, they when it still comes to negotiating the price for their products, they still need to earn it. So it's so interesting. They said they treat them like gold, but they still need to earn their way towards the value that needs to be driven. And the reason they're inside is that they want to make sure they substantiate that value around how they are producing their raw materials that they buy and making sure that they're not paying any higher price than they should. So it's just an interesting journey and maturity level that they've reached in that industry.
Yes.
Tom, that was a great.
I think we can go to the
great
poll
recap.
question. I'm sorry. Yeah, let's go to the poll question if we can. I don't know if it's popping up, or we'll try again.
There we go.
So, do you believe the healthcare industry has made any progress in better trading partner collaboration in the past 5 years?
Yeah, this was, I hope the poll works because this is an interesting one.
It appears to be working. Hopefully we can get some responses from the attendees.
Great.
Christine, how much longer till we close the poll?
I'll close it now. We have some good responses.
All right. Very good. And there we have the responses. No one selected a great deal, but yes, some 64%, not much. So 36%. So right in the middle there with that particular question as to whether or not we've made any progress. It's sort of right, almost, if you took this, I'd say we're just slightly over neutral with some progress, perhaps. Great.
Yeah.
Right, Les, we'll turn this over to you, and I'll ask Christine to go to the next slide for you.
Yes. So what I had spoke to John and Tom about is an example of a collaborative program, and there are many suppliers that have these. So this is certainly not something that I'm going to say is unique to us at all. But it's an effort that we've put forth in trying to align to the perfect deal collaboration. If we go back, if we remember the slide that Tom was walking through of where do we collaborate and where do we truly take equal amount of risk, both as a supplier and as a healthcare provider, with the goal being of being able to impact cost, quality, outcomes, and also satisfaction of the end user. So the importance of the physician or the clinical team being happier because things are working better. And so basically this is around the service of products. So I'm using an example, not showing you a real customer. The data does happen in real customers, but I just want to kind of walk you through what we did. But the key is we picked a key area, we focused on it, we put the analytics together, we benchmark the entire US user base of certain technologies, and we come up with, what is the best standards. And then we say, okay, the best standard is a 10, you're at a 15. And we sit down with the client if they're so interested in doing everything that Tom and John just mentioned, which is work hard, put the effort in, take some time, trust each other, that we work together on a collaborative program. So basically what you're seeing in the upper right-hand corner of the slide there is if we identify a cost structure and the client agrees with that analytics, what we do is as a supplier, we protect the customer if they go over. So if they needed more service than they contracted for example, we protect them to a level of 120% of that, or 20% overage. Likewise, if they work hard as a healthcare provider and bring down their costs and improve their operations with our help, we certainly help them do that. We actually are allowing a share back of some of that savings. And so it's been a very successful program, but it is one that requires a tremendous amount of work, as we just talked about. Next slide, Christine. So the example here, I'll just kind of walk you through, what it would look like. So for example, what you're seeing there is the dotted line in the chart. It would be the actual cost. In the event that the client only went over a little bit, there would be no additional charge in scenario one. So we, the supplier, would absorb that cost. In scenario two, they really weren't able to impact change, and actually it got much worse. We still absorbed incremental cost up to a certain level, but then after that, the healthcare provider does begin paying again. And then likewise in scenario three, for that healthcare provider who really worked hard with the entire chain of events and the technologies that are being used, we're able to have a savings of $66,000 that came back to them. So again, the goal being aligning to an issue that they want help with. As Tom showed, or John showed earlier in one of his slides, cost is not the driving factor of most relationships, but it can be a great part of the cost, quality, and outcomes of a relationship. So it can be done. It can be done, but collaboration like this is a lot of work for both the supplier and the healthcare provider. So not every healthcare provider in the United States is ready for it, and not every supplier in the United States is ready for it either. And so this is our first effort in that area. And hopefully we'll be able to take some questions if there are any. So I'd like to put a discussion question out there, and if you would, we could, and I'd pose this to both Tom and John. Often, better trading partner collaboration is determined by the monetary size of the relationship because of the time involved. Do you believe that this is the correct metric? Or can better trading partner relationships also be engaged in smaller, strategically important supplier-customer relationships? Tom?
Yeah, so, I thought about this, and, I really came to the conclusion that it shouldn't always be monetary. I think we look to that because the scale of size of the spend and the breadth of a portfolio that we buy from a common supplier, generally you think that there's then the ability to drive value beyond price because they're rich in resources and intelligence and capabilities that could be brought inside a provider organization. But clearly, when I look at, I don't know if that's that might be a place to start and say, hey, we ought to explore, because if they are such a big part of our spend, how do we go beyond just obviously the transactional level? However, when I think of, the goal, as I said, the alignment of goals and expectations should really be driving that. And sometimes it's nothing to do with saving, but how do you measure impact? So let's just take an example out, because I'm knee deep in this right now, but, moving from Lawson to Workday. Well, Workday is pretty important, because if I don't have a good user end experience that's impactful to those around how we requisition, process POs, and everything else, that can go south quickly around how a supply chain is thought of and perceived inside an organization. So the impact around the experience in this case with end user satisfaction around requisitioning and processing POs is certainly an impactful consideration. So, besides savings, this is really more about how do I shape the experience of a supply chain operation that I think is also a strong consideration. When we think about safety, a lot of suppliers in this place spend a lot of energy in this space, right? But training of staff so that we're safe in using and appropriately using the products and optimizing the technology that's there is something that's also very important. How do we measure that impact, maybe by skill and competency growth and training of our team that's using a specific piece of technology is another example around that should be considered. So those are a couple examples, Les, that I thought of.
Yeah, no, very, very good points, Tom. And John, your thoughts?
Oh, I agree with Tom completely. The example that comes to mind for me might be something like critical items for the OR, where it may not represent enough spend on an annual basis to reach the top 20 or 30 suppliers, but it's such critical material that you need to have a good relationship, particularly now that we're operating post-COVID, sort of, and we're trying to restart elective procedures. So a good example might be you might have a relationship like this with your number one orthopedic implant supplier, but if you've got two, it may also bode well for you if you're the purchaser to have one with the second most important supplier as well when measured by monetary means, because these are critical items. Some items may have been in short supply or may become in short supply as we've scaled back up. And so I think you've got to look at the critical nature of the products and the kind of things that are being bought and the sensitivity to patient satisfaction and surgeon satisfaction both.
Yeah, no, very good points. Christine, you can go to the next slide, and then if you could put up the polling question, the last one. So while that's coming up, I'm going to go ahead and walk us through that. Considering the impact of COVID-19 on the entire healthcare delivery system in the United States and the need for supply chain readiness for this and future pandemics, our improved trading partner relationships, and you can see the answers there. So please answer it for us. Thank you.
And while we're waiting for those answers, I do have a question for all of you from Susan Lewis, who wants to know, and I think you answered this a little bit less, but I'd like to have a little more conversation about this, whether trading partner collaboration applies across all product categories and how it might apply differently across different product categories. If you and Tom and Les and John, if you could address that, please, while we're waiting for the answers to the poll.
Could you read that again?
I can. Does collaboration apply across all product categories? And if not, how might it be different for one product category or another?
And Tom, I want you to think about this. This is less version of that. I think it comes back to that issue of making sure that you've segmented those products that make sense. So if it's mission critical and it's not mission critical, or it's considered a consumable, or it's custom technology that can only be made in one place in the world, which has obviously impacted us right now. So I don't think collaboration can happen on every product used by a hospital. That's my own opinion. Tom?
Well, I totally agree that it's across all product portfolio. The segmentation is indeed useful and helpful, but clearly I think any of these collaborative relationships, whether it's a simple collaborative one project to a series of projects with the same supplier over a different set of portfolio of product categories. But a lot of these are services too. And let's not forget around how important they are in terms of, again, enhancing and improving the supply chain operations and so forth. So I think it's broadly applied to a lot of the product and service categories.
Yeah, this is John. I agree with Tom's assessment of that. And since it's Susan Lewis who asked the question, I'd say that you should always have a collaborative relationship with your office supplier.
Yes.
So the results for the next, or for the final question are up right now. About 78% said more important for the need for readiness and improved trading partner relationships, and 22% about the same. So kind of an interesting result there. I would ask Nancy or Christine, do you want to try to ask the first question again, or should we just move on? We're reaching the end here.
Yeah, I think the first question went AWOL somehow, and we can't get it back to a point where we can ask it. It's only giving us answers now. It won't let us ask the question again. So I'm sorry about that, John. But at least we got the last two, the second and third polling questions done.
That's okay. Well, I'd like to thank Tom and Les. They have been both great teammates on this project, and I'd like to thank SMI for a number of great years of doing research on this, and the results are out there. I think Nancy and Christine have a couple of wrap-up items, so I'll turn it back to them.
Thank you very much, John, Tom, and Les. We really appreciate all of your long commitment to this work, some great learnings that we've heard more about today, and certainly we will be sharing this recording along with the slides and any other notes that have come out of this initiative on our website through our toolkit. So if there's folks on your teams, all of our participants that you think would benefit from hearing this same presentation and learning more about these great perspectives on trading partner collaboration, it will be available to you and to the industry. And again, thanks to Tom and Les and John for all the great work and for being with us today. Christine, next slide. I did want to make everyone aware, previous slide, looks like we skipped one. I did want to make everyone aware that SMI, through our initiatives discussion with members in the Vision 2020 series a couple of weeks ago, we've identified 3 new initiative topics. They sort of fall within the clinical integration and business continuity work that we were doing, but we've tried to create more of a sprint type of initiative to recognize that right now members are really juggling a lot of priorities. We know that you're all still in the thick of the COVID-19 crisis to one degree or another. And so we're trying to create some initiatives that are going to last about 3 months, that will entail 3 phone calls, and that will entail no more than 3 hours of research maximum, so that we can get everyone involved, take advantage of the great brain power and the leadership of SMI, and yet allow you to do it within a time frame that's reasonable relative to your other priorities. So the 3 new initiative opportunities that we're going to be launching here in July, first we're going to be looking at demand planning, ways to use data to more effectively forecast demand. We're going to be looking at national and regional inventory preparedness and coordination, and developing some recommendations around the strategic national stockpile and some regional inventory stockpiles to help make sure we've got the right product available and the right kinds of backup resources for future pandemics and other emergencies. And then the third one we're going to be focusing on is what we've talked about a little bit today, virtual relationships. And creating tools for effective virtual trading partner relationships. Now that we are seeing that things are going to be staying in the virtual world for at least a little bit longer, and probably continuing to be virtual to one degree or another for a long time, we want to make sure we create some tools to help support that. So please email Christine or me if any of you would like to join one of these initiative teams. Again, we will be launching them toward the end of July. We're going to make this as simple as we can so that we can get the great input of our members without having it take too much of your time these days. So thanks so much for being a part of these initiatives. We're looking forward to having everybody participate and having you provide your input. And then we will have an evaluation right after you're finished with the call today. We will have an evaluation of today's session. So we'd love for you to just stay on the GoToMeeting and finish the evaluation before you jump off the call. and are looking forward to getting your input so we can continue to deliver great programming for you as we go forward. I apologize for some of the technical difficulties in the GoToMeeting application today. I think we're going to be trying to find ways to move to Zoom more and more and use GoToMeeting less and less. We've had some great experiences with Zoom through the Vision 2020 series, and I think we'll be using that more given our experiences today. So once again, one more slide, Christine. I wanted to say thank you to the team that did this great work on creating partner collaboration, and also thank you to all of you for joining us today. Watch your email. We will have some upcoming educational programs and networking opportunities that we're going to be offering to all of our SMI members, and we're looking forward to having you participate in all those programs as they come up. Thanks so much for being a part of this today, and do stay in touch. Thank you.